Something huge is happening right now all around the world in the way we think about protecting our vision. We're in the middle of this massive shift, moving away from just reacting to eye diseases when they pop up to this incredible, coordinated global effort to stop them before they even start. We're going to dive into how this is all unfolding, especially for conditions like age-related macular degeneration.
So why all the urgency? Well, you just have to follow the money. And get this, we're not even talking about medical bills here. This number, $411 billion, is what the global economy loses in productivity every single year because of vision problems. A number that big isn't just a statistic, it's a massive wake-up call that's forcing governments to completely rethink how they approach eye health.
And here's the really crucial part. As big as the problem is, it's largely solvable. Right now, there are 1 billion people living with vision issues that could either be prevented entirely or treated. That makes this more than just a health crisis. It's a crisis of access, of strategy, and that, finally, is starting to change. So how in the world do you tackle a problem on that scale? You have to start with a global game plan, right? And that's exactly what's happening. The World Health Organization is really leading the charge here, pushing every country to move away from these isolated disease-by-disease treatments toward a much more unified, cohesive strategy. The core idea behind all of this has a bit of a jargony name: Integrated People-Centered Eye Care, or IPCE. Now, I know it sounds super technical, but the concept is actually incredibly simple. Stop treating our eyes like they're totally separate from the rest of our bodies. The goal is to make eye health a basic, fundamental part of your regular healthcare, just like getting your blood pressure checked. It's about looking at the whole person, not just their eyeballs. And to make this real, the WHO laid out this clear, actionable roadmap called the SPECS 2030 Initiative. Just look at the pillars here: services, personnel, education, cost, and surveillance. This isn't just wishful thinking. It's a comprehensive plan that covers everything from training more eye care professionals to making sure care is affordable to actually using data to see what's working and what's not. Okay, so a global blueprint is a fantastic start, but it doesn't mean a thing until countries actually start putting it into practice. So let's take a look at how different nations are taking these big ideas and tailoring them to their own unique healthcare systems. First up, let's head to Canada. For a long time, Canadian eye care was pretty fragmented, varying a lot from place to place. But now they're making a really bold move to create a single national framework to make sure everyone gets consistent care. And this isn't just talk, it's being driven by actual legislation, Bill C-284. It calls for a national strategy that does a few key things. It wants to speed up the approval process for new drugs and devices, and maybe most importantly, it puts a huge focus on health equity, especially for Indigenous peoples and folks in remote communities who often get left behind. It even created an AMD Awareness Month just to get people talking and learning. Now, let's hop over to the United States, which is tackling this problem from 2 different angles at once. They're pushing the absolute limits of scientific research while also trying to navigate their incredibly complex payment and reimbursement system. So on one hand, you have the National Eye Institute making these bold predictions about game-changing fields like regenerative medicine and AI. But on the other hand, you have the economic reality. Medicare, which covers most AMD treatments, is tightening its belt. There are proposals that could actually reduce payments for eye care. It perfectly captures this tension between amazing innovation and the real-world financial pressures of healthcare. Meanwhile, across the Atlantic, the European Union's strategy is really all about teamwork and technology. Their big focus is on creating consistent standards for all its member countries and using digital health tools to make eye care way more efficient and accessible for everyone. So how's that playing out? Well, they're standardizing how new technology gets evaluated, so everyone's on the same page. They're also shifting routine care out of busy hospitals and into local community clinics. A huge deal. And they're even funding projects that use AI to screen for diseases like AMD during a regular primary care visit. It's this continent-wide push for just smarter, more convenient eye health. Okay, so all of these big policy changes are paving the way for some incredible new technologies and a much bigger focus on prevention. So what does the future of eye care actually look like for us, for the patients? This chart right here really tells you everything you need to know about why prevention is the new buzzword. Look at this. For advanced AMD in the US, the actual medical bills are only about 11% of the total cost. The vast majority of the burden comes from lost productivity and just a lower quality of life. This is powerful proof that stopping the disease before it gets bad is so much more valuable than just treating it later. And for people who do need treatment, wow, the burden can be huge. This quote comes from a recent survey of retinal specialists in Europe, and it's striking. The biggest challenge for their patients isn't the cost or the fear, it's the sheer number of injections they have to get. That's the human cost that is driving this intense search for treatments that last longer and are less invasive. So you can see the focus is really shifting. Instead of waiting around and just reacting when the disease is already advanced, the new model is all about being proactive. We're talking about public health policies that encourage healthier diets, that promote supplements that we know work for people at risk, and especially that get serious about tobacco control, which is still the single biggest risk factor that we can actually change. Technology is also making care so much more accessible. Take something like remote patient monitoring. Health systems are finally creating clear rules for how doctors can get paid to monitor their patients from home. This is a total game changer, especially for people in rural areas or anyone who has trouble getting around. It makes continuous care a real possibility without needing constant trips to the clinic. All right, so we've looked at the big global strategy. We've seen how different countries are putting their own spin on it. So what's the big picture here? What are the common threads that give us a clearer path forward in this worldwide fight for sight? It really boils down to these four key themes. First, integration, moving eye care out of those specialist clinics and into your local community health center. Second, economics, finally recognizing that preventing vision loss is actually a brilliant economic strategy. Third is technology, going all in on tools like AI and remote monitoring. And last, but definitely not least, is equity, making absolutely sure that no one gets left behind. So the strategies are being put in place, and the technology is getting better faster than ever before. But it all really comes down to this one final crucial question. As our global population gets older, the demand for eye care is about to explode. The real test is going to be whether our policies and our tech can adapt quickly enough to protect our collective vision. The race is officially on.